So if you suffer from knee pain, then you know how debilitating it can be, how painful it can be. And one option is, of course, knee replacement surgery. But there is a less invasive option that you may not know about, and we want to share with you today. Joining me now to explain is Dr. Eric Boyd from the Pain Institute, and you've brought along with you your patient, Larry Pomeroy. So welcome to the show, Larry, and Dr. Eric. We appreciate you being in here.
Thank you.
So how bad are knee problems becoming for Americans?
Well, the incidence of osteoarthritis of the knee is on an uprise, maybe because our population is getting older. It may also because we're working harder or playing harder than ever.
I think it might even be to do with the fact that so many of us are carrying extra weight.
Absolutely, absolutely. Our population is becoming more obese. We have more healthcare problems. And so a lot of people out there suffering with knee pain have been told the only choice they have is a knee replacement.
So what is this new, it sounds very futuristic, Bionicare technology?
Bionicare is a technology that has basically two parts to it. The first part is a brace system which offloads the compartment of the knee that has the bad osteoarthritis. And the second part is
so in layman's terms, this is providing support for this?
Yeah, this is providing support for a knee that may have arthritis in the lateral compartment or a medial compartment, or maybe all compartments of the knee are narrowed and they're bone on bone. And what this will do is take some of that weight off of that joint, perhaps open it up slightly mechanically. And then the second part of this device is a stimulation device. There's two stimulator pads that are on here. There's a pad that goes across the patella, the kneecap itself, and then there's a part that goes above along the thigh.
Okay.
And this provides a low electrical stimulation across the joint that actually relieves pain and gives people comfort that have bad pain.
Speaking of people, Larry, you're wearing them right now, and you've got your little box right here that is attached down to the kneecap, right?
Yes.
So how did you get your knees that end up in this condition?
Osteoarthritis from age.
Really? And so on a scale of 1 to 10 in terms of discomfort, where were you before you started using this Bionicare?
7 to 8.
On a regular basis?
Very severe pain, yes.
And did you try other things?
Yes, I've tried all types of injections with no avail.
And so when you got this, did you kind of think like me, like this is kind of futuristic, I don't know if this is going to work?
I was very skeptical.
Okay.
But within a week, I became a believer.
Really?
The pain reduction is at least 75%.
Okay, and so what does that mean in terms of quality of life? Because really, that's what we're talking about here.
I was to the place where I couldn't hardly walk through a grocery store. Now I can go out and walk and be nearly pain-free.
Well, now your sweet wife that's standing behind the camera says, no excuses, get to the grocery store for me, right?
That's right, yes, and go to the mall.
Absolutely.
So let's get back to this and tell me, who is a good candidate for this?
So this is basically the good cancer. People who have osteoarthritis of the knee, could be anywhere from mild to severe, who either don't want a knee replacement or can't have a knee replacement. So, we're seeing osteoarthritis in people as young as 45, 46, 47 years old that are really too young for a knee replacement at this point in time because sometimes the knee replacement devices only last 10, 15, 20 years. And so,
do you lose mobility when you put this brace on?
I'll have Larry answer that for you. What do you think of that, Larry?
No, they look like they would be uncomfortable, but
it does look like you'd
not.
have a little bit of, loss of mobility.
You've got lots of mobility. They're not uncomfortable at all.
Do you sleep with them?
You can. I generally take mine off and just wear it during the day.
Okay.
I wear it 5 to 8 hours a day.
I want to bring up some pictures and show exactly kind of what we're doing on the insides, the mechanics of it, if you will.
Sure. So here's a picture of electrical current that goes across the space of the knee. And some say it may mimic the healthy current that patients used to have going through the knee before they developed osteoarthritis. We do know that electrical stimulation across the joints help with knee pain from osteoarthritis for years, but this device, the type of current it delivers, along with the fact that this brace offloads the knee joint and actually makes it feel better, the two of these together are making big changes in people as far as managing their pain.
So when people at home are watching this and going, yeah, I'll try anything, I'm in a lot of pain, they're probably going, yeah, but it looks futuristic and it may have that big price tag because of it. But you said that you got it covered by Medicare, huh?
Yes, covered by Medicare, and the cost is quite reasonable.
All right. Well, when you talk about getting your quality of life back?
Sure, without a knee replacement surgery, costs a lot more than devices like this. Our patients are living longer, they're more active than ever before, and we're trying to get them to that point.
Well, thank you so much, Dr. Boyd.
Thank
Appreciate you, Larry. Pleasure.
Thank you.
And good luck to you and your knees. Make sure that you're helping your wife in the kitchen, huh?
Yes.
And then the grocery store. No excuses now, right? How long have you been married?
43 years.
43 years. Wow. We'll have to talk. You've got some stories, I'm sure. We're going to have some information on our website coming up a little bit later about how you can find out more about this technology and provide some information on how you can reach them there as well.